morning, everybody. My name is Rachel, and I'm late for the class, and I apologize for that. I'm doing healthcare administrations as my career presentation, which is a professional level, professional grade field, and I apologize for my unprofessionalism this morning. Luckily, I have a 4-year-old that woke me up earlier than I would have woken up, but late. But I will start with healthcare administrations. There are a wide variety of titles and positions that this encompasses. There are more than about 25 actual specific positions that somebody can hold. Here are a couple examples of those. Here are some, hey, stop it. Okay. And so I have grouped the healthcare administration titles into 5 areas of work that I thought would be helpful to narrow it down. And each group is similar in their job duties and their professional pay grade. So here are some titles like clinic administrator, health unit coordinator, and such. And people in these positions can be generalists, or they can manage an entire facility or specialize in one group or area, as in like a dental office administrator would work specifically in the dental field. Another category would be like your human resources, your social worker, your community activist. And there's some job duties down at the bottom that this position might entail for someone thinking about this line of work. Health information management is going to be one of your highest paying but highest education level, one of your highest education required levels. But medical records administration, medical coding and billing, I know everyone's heard of that one. And then there are some job duties as well. Another group might be your financial area of it. Again, so when you walk into a hospital, you see everyone behind the scenes, maybe behind the front desk doing inpatient check-in. There's also people back in the office area doing all of the administrative insurance coding work. Then there's going to be like your long-term care management, which would be small or large elder group homes. And these have their own very specific job duties for the job position. It's another group to think about. And then here, so you can work in lots of different environments. Mainly it's going to be indoors in an office, probably behind a desk and mainly with a computer, but also around lots of other people and in different types of buildings and corporations. And just in case you were thinking about this occupation, here are some things that would make you a good fit for the job if you enjoy working with numbers and data, science and technology, and working indoors. Also, you would be a good fit for the job if you are good at active listening, critical reading and writing, and things of this nature. So, as we've all found out with these healthcare career fields, that the job outlook is good. So roughly 15 to 20% growth. They're looking more in the 17 to 20% growth for healthcare administration jobs. As hospitals and care facilities get larger, they require more management positions to help them run smoothly as they take in more patients. So your skills plus your traits would make you a very good fit for this job. So some of the traits that you would want as your personal traits that you could bring to the would be you're dependable, cooperative, and have high ethical standards. Your skills would be leadership, decision maker, and again, I'll go back to the last one. So in all of my research, the bottom, generally be a people person. No matter which field of healthcare administration that you choose, you will end up working with other patients, physicians, and coworkers. So again, education is dependent on, salary is going to be dependent on your education and your work experience level. So according to the Bureau of Labor Statistics, Here are some of the median annual wages for just a few jobs that I have chosen to pick out. Medical records and health information technicians, $38,000 a year. Medical transcriptionist, $35,700 a year. Occupational health and safety specialist, $66,800 annually a year. And then your medical and health services managers, which would be the top of this category and your prime objective as you move up the career ladder, would be $96,000 a year. So entry level, you must have some type of second college education, typically a bachelor's. 2 years post associates would be also specializing in your field of choice. So a lot of the time employers are going to look for, while you're going to school, doing some type of clinical work, either whether it be job practicum or unpaid volunteerism. Typical degrees for this field are health administrator, health management, nursing, public health, and business administrator. There are a few more areas you can specialize in, but any of these degrees that you get along with your bachelor's would help you be an entry-level individual. And then, so the higher education standards, they are recognized and there are programs out there, but you do not have to be accredited or licensed or registered for any field in healthcare except long-term care facility, which would be your elder care. If you would like to be an administrator in that field, you do have to have a licensure, which you can get from Oregon licensing. The health licensing office here in Oregon, every state does require you to have a license to run a long-term care facility. Here are a couple of the acronyms for accreditation recognized by employers that you can get through your schools that will help you move up in the career ladder, will help you know your job duties and do them well. Registered Health Information Technician, the Commission on Accreditation in Health Information and Informatics Management, and then your Registered Health Information Administrator. So like under Registered Health Information Administrator, there's 12 job titles that I found readily available just under that specific degree. That's why the field can be very broad. So, and last but not least, in conclusion, there's a bonus to this profession. You do get your own holiday. It is recognized as Administrative Professionals Day, and it is the third Thursday in April. So you can always look forward to getting some type of recognition for that. And here are my citations. Thank you.
Any questions? All right, great, thank you. Levi.